I think something happened in the last video. I'm just restarting again. Let me wait for the others to join so we can restart. All right, so this again, I will repeat that this today's session is going to be about the previously asked questions on general chemotherapy topic. And first, I'll be discussing few important questions which have been asked in the previous years. And in the end, I'll give you a take on what are the important key points you should practice from that very topic. So let me start with the first question itself. The first question is, all of the following are bactericidal except isoniazid, daptomycin, gentamicin or tigecycline. So out of these 4 drugs, which one is not bactericidal? Isoniazid, daptomycin, gentamicin or tigecycline. Which of these drugs is not bactericidal in the other sense I want to tell you? So can you tell me, anybody, that which of the following drug out of these 4 is not bactericidal? Isoniazid, daptomycin, gentamicin and tigecycline. Which is not bactericidal out of all these 4? Which is not bactericidal? Okay, you say sensitive soul says isoniazid. Okay. Can't listen? Okay, just a second. Now, am I audible now? Which of the following drugs is not bactericidal out of these 4? Isoniazid, daptomycin, gentamicin or tigecycline. Okay, Dr. Shiv says isoniazid. So you mean to say isoniazid is not bactericidal. Okay. Any other? No? Alright. Okay, I'll tell you. So out of all these 4, so let me tell you that isoniazid, daptomycin, gentamicin, all these 3 are bactericidal drugs. So out of these options, only tigecycline is not bactericidal. Isoniazid is bactericidal. It is one of the anti-tubercular drug which is bactericidal. Okay? So if you see all the first line anti-TB drugs, unme se there is only one drug which is static, the rest all are cidal. So isoniazid is a bactericidal drug. Tigecycline is not bactericidal drug. And this is a drug which inhibits the protein synthesis. Right? So it inhibits the protein synthesis. So you'll see mostly all the drugs which inhibit the protein synthesis, they tend to be bacteriostatic, but exceptions are there, right? Aminoglycoside is an exception. This is a drug which inhibits the protein synthesis, but it is still bactericidal. But most of the drugs which will inhibit the protein synthesis, they tend to be bacteriostatic drugs. So tigecycline, a glial cycline drug, which is a bacteriostatic, not bactericidal drug. So remember this, tigecycline is a bacteriostatic, not a bactericidal out of these options. And this drug is used against various serious skin and other complicated infections, including the MRSA or the VRSA. Right? So this is an important thing to know. So which drugs are bactericidal, which drugs are bacteriostatic. The second question is, listen to this carefully, the second question. The persistent suppression of bacterial growth. The persistent suppression of bacterial growth that may occur after exposure to some antimicrobial drug is called. The persistent suppression of bacterial growth that may occur after some limited or some exposure to an antimicrobial drug is called. First option, is this phenomena called as time-dependent killing? Second option, is this called as concentration dependent killing? Number 3, is this called as post antibiotic effect? Number 4, is this called as sequential blockade? I will repeat the question again. The persistent suppression of bacterial growth that can occur after limited exposure to some antimicrobial drug is called as time-dependent killing, concentration-dependent killing, post-antibiotic effect, or sequential blockade. So what is this phenomena called as? Persistent suppression of bacterial growth which can occur after an exposure to some antimicrobial drug. What can be the phenomena out of these 4 options? Time dependent killing hai, concentration dependent killing hai, post antibiotic effect hai, or is it a sequential block? So all these terms are very important to know from general principles of chemotherapy. This is very important from this point of view. What is time dependent killing? What is post antibiotic effect? What is concentration dependent killing? And what is sequential block? So this persistent suppression of the growth which occurs after exposure to an antimicrobial drug is called as, yes, it is a post-antibiotic effect, right? So when you see certain drugs or antibiotics, when you give the antibiotics in certain cases, the bacterial growth can stop after an exposure to that drug. Very good, Sumit. Yes, it is post-antibiotic effect. So the bacterial growth will stop after when the microorganism is exposed to this antibiotic. And even when you take this microorganism and put it in a medium which doesn't have this particular antibiotic, it will take some time to again start growing. So therefore there is a period, lag period. The antibiotic has shown some effect on the growth of the microorganism. It has stopped the growth of the microorganism. And even when the antibiotic is not there, that microorganism will take some time to regrow. And that is called as the lag period. How much time the organism takes to again regrow even when the antibiotic is not there. So this is called as the post-antibiotic effect. And in some drugs, this post-antibiotic effect is very long. And in some drugs, the post-antibiotic effect is very short. So for example, certain drugs like carbapenems, aminoglycosides, they have a very long post-antibiotic effect. So even when the drug is not present, you cannot measure it in the plasma, still it will be having the effect on the microorganisms. So there's a reason, that's why we can give it in less frequent doses because of this post-antibiotic effect. So please remember, then time-dependent killing is another phenomena shown by certain antibiotics. So can you tell me which antibiotic shows time-dependent killing? Anybody who can tell me which antibiotics, they show time-dependent killing? That means their action or effect on the bacteria depends on the time for which they are over the minimum inhibitory concentration. So any example of the bacteria which shows time-dependent killing? These are important MCQ questions. So you can be asked MCQ like which of the following bacteria shows time-dependent killing? Which of the following bacteria shows concentration-dependent killing? So again, any important example that anybody can give me for bacteria showing time-dependent killing? No? Beta-lactams, they can show time-dependent killing. Then concentration-dependent killing, it can be shown by drugs like aminoglycosides, concentration-dependent killing, aminoglycosides, fluoroquinolones, they show concentration-dependent killing. So please, all these 3, time-dependent killing, yes, penicillins, they show the time-dependent killing. So very important to know which of the drugs, cephalosporins, beta-lactams, all beta-lactams, they show time-dependent killing. So कौन सी ड्रग्स टाइम डिपेंडेंट किलिंग शो करती हैं, विच ऑफ द ड्रग्स शो पोस्ट एंटीबायोटिक इफेक्ट एंड विच ऑफ द ड्रग्स शो कॉन्सेंट्रेशन डिपेंडेंट किलिंग. वेरी इंपॉर्टेंट टू नो. The third question I'm going to come to is, a bactericidal drug would be preferred over a bacteriostatic drug in patients of. A bactericidal drug would be preferred over a bacteriostatic drug in patients of. First option, neutropenia, cirrhosis, pneumonia or heart disease. 4 options हैं. neutropenia, cirrhosis, pneumonia, or heart disease. In which of these conditions would you prefer to give a bactericidal drug rather than a bacteriostatic drug or a bacteriostatic drug? Whether in a patient of who has neutropenia, whether a patient who has cirrhosis, pneumonia, or heart disease. Which of these conditions warrants the use of a bactericidal drug rather than a bacteriostatic drug? Yes? Which of these conditions would you prefer to give a bactericidal and not a bacteriostatic drug? Neutropenia, cirrhosis, pneumonia. Someone says pneumonia. Cirrhosis, pneumonia, heart disease. Kiss me. Pneumonia. Okay. Cirrhosis. Okay. See, why would you want to give a bactericidal drug? Bacteriostatic kya karta hai? It will just inhibit the growth of the bacteria, that's all. While a bactericidal will kill the bacteria. Okay? Yes, neutropenia. Very good, sensitive souls. It is neutropenia. The reason is, see, if a patient or if a person, his immune system is good enough and you give a bacteriostatic drug to that person, it will inhibit the growth of the bacteria and your body's defense mechanism can take care of the rest of the microorganisms. No problem. But patients or people who have neutropenia, they do not have the good immune system to fight the bacteria, even if their growth is stopped. So for them, if you give a bacteriostatic drug, they will stop the growth of the bacteria. But after a while, again, those bacteria, they will regrow and affect the patient or attack the patient. So it's in those cases, patients who have neutropenia, people who are on like say immunosuppressants, those HIV positive patients and all. So what happens in those, it is better to give a bactericidal drug because they don't have the capacity to fight the bacteria on their own. Their body's immune system is not great enough to fight the bacteria, however small or whatever small amount of bacteria is there. So they always prefer a bactericidal drug. So for neutropenia patients, we prefer the drugs which are cidal as compared to the drugs which are more static. So remember, for cidal drugs, most of the drugs which are going for, yes, any, you can say, it's a cancerous condition, right? Leukemia. So the therapy is different there. It's a cancer. We give anti-cancers over there, right? And because we are giving anti-cancer therapy, again, the immune system is down. Then you have to give bactericidal drugs, right? So what happens in cidal drugs, remember, all the drugs which are going to fight or which are going to attack the cell wall synthesis, they mostly are cidal drugs, like your penicillins, beta-lactams overall, penicillins, cephalosporins and all, even vancomycin, polymyxin B. They are all cidal drugs which target the cell wall synthesis. And most of the drugs, I say not all, but most of the drugs which target the protein synthesis, they are static. Exceptions, I've told you, aminoglycosides are an exception. They are going to target the protein synthesis, but still they are cidal drugs because they are one step ahead of the protein also. And then streptogramins also. So these are exceptions to the rule. But otherwise, mostly it is the drugs which inhibit the cell wall synthesis, they are cidal. And the ones which are towards the protein synthesis, they tend to be more static in nature. So again, bactericidal preferred over bacteriostatic in cases of people who have a low immune system, a low in a neutropenia basically, because of any of the reasons. Right? All right. Now, the next question is, anaerobic bacteria are inherently resistant to. Anaerobic bacteria are inherently resistant to beta-lactams, aminoglycosides, chloramphenicol, or metronidazole. Anaerobic bacteria are inherently resistant to, matlab they are naturally resistant to. Inherently means they are naturally resistant to beta-lactams, aminoglycosides, chloramphenicol, or metronidazole. So in other words, if you want to understand the question, it means which of these drugs will be ineffective in case of anaerobic infections. Beta-lactams, aminoglycosides, chloramphenicol, metronidazole. Anaerobic bacteria are inherently resistant to which of these drugs? Yes. Metronidazole, okay. You know that metronidazole is, okay, I'll tell you, it's preferred in anaerobic infections, one of the drug of choice for anaerobic infections. Beta-lactams, aminoglycosides, chloramphenicol, metronidazole. No, it's not metronidazole. Metronidazole is one of the preferred drugs for anaerobic infections. Chloramphenicol, no. They're not resistant to chloramphenicol. Natural resistance means there's something which is naturally present in those bacteria, or there is something, this antibiotic will not be able to actually affect the anaerobic bacteria. There's something in their structure, or very good, aminoglycosides. Yes, these are aminoglycosides. Can you tell me why are they inherently resistant? Aminoglycosides, why are they resistant, or why aminoglycosides don't work with anaerobic bacteria, or they don't work on anaerobic bacteria? Aminoglycosides में ऐसा क्या है, or what is the reason aminoglycosides are not effective in anaerobic infections? They are not effective in anaerobic infections. They can't cover, yes, they cannot cover anaerobes. Why? I'm asking the reason. Why they do not cover anaerobes? That's why I'm saying inherent resistance, and it's a natural resistance. Because of some process, it happens. Good evening, Surya. Okay, so what happens if you study the mechanism? The answer lies in the mechanism of action of aminoglycosides. So when you study the mechanism of action of aminoglycosides, you'll see that they require aerobic environment to get inside the bacteria, because they have to target ultimately the proteins. Very good. Yes, oxygen dependent killing, or it's like the process is oxygen dependent basically, to get inside the bacteria so that it can attach to the ribosomes and perform the action. So jab tak it won't get into the bacteria, it will not be able to act. So that process requires oxygen, right? So that process of getting inside the bacteria requires oxygen. So where in anaerobic environment, that oxygen is not there. So therefore anaerobic environment, let's say even in pus and everything, where it is an anaerobic environment, it cannot function well because it requires oxygen. So therefore anaerobic bacteria become resistant. They are already inherently resistant to the action of aminoglycosides. So this is the reason, because it won't be able to get inside the bacteria to perform its action, right? Okay. Yes, no, this one is not enzyme induction. This is, that is a different concept. This is mechanism of action of, I'm talking about aminoglycosides. The thing is that it is not able to get inside. You know, there are steps of aminoglycosides action. So in the second step, basically, it requires oxygen to get inside the, the nucleus and perform the action on the ribosomes. That is the thing. Okay? Yes. It only needs oxygen. Oxygen nahi hai, then it cannot function. All right. The next question is, drug with low therapeutic index. Drugs with low therapeutic index include all except. Drug with low therapeutic index include all except. First is erythromycin. Second is gentamicin. Third is vancomycin. Fourth is chloramphenicol. Drug with low therapeutic index include all except erythromycin, gentamicin, vancomycin, chloramphenicol. So which of these drugs, which one drug doesn't have a low therapeutic index? Erythromycin में नहीं है, gentamicin नहीं है, vancomycin नहीं है, कि chloramphenicol नहीं है. So which has a broader safety index, you can say. It has a higher safety index out of these. Yes. Which of the following has a high therapeutic index, if I want to put it that way? Erythromycin, gentamicin, vancomycin, chloramphenicol. So 3 of them have low therapeutic index and 1 among them has a higher therapeutic index. And with that, I mean that they won't require, like toxicity effects would be less, won't require that much of monitoring and, looking again and again at the doses and the patient. So that is one thing. Gentamicin, vancomycin, chloramphenicol, yeah, erythromycin. Very good, Arnav. Yes, erythromycin. So erythromycin is one drug. No, chloramphenicol is not. It's not a very safer drug. It can lead to a lot of side effects. We have to look for the toxicity. So chloramphenicol has a low therapeutic index. Vancomycin has a low therapeutic index. Gentamicin, aminoglycosides are notoriously very toxic drugs. So they also have a low therapeutic index. Out of this, only erythromycin is that drug which doesn't have a low therapeutic index. Yes. Even penicillins are drugs which have a higher therapeutic index. Yeah, erythromycin. Correct. Yes, it is the correct answer. Erythromycin, these are safer drugs. All right. Next question. Enzyme inactivation is the major mechanism of resistance in. Enzyme inactivation is the major mechanism of resistance in. Number 1 option, sulfonamides, norfloxacin, gentamicin or tetracycline. Out of these 4, which, you have in the chapter of general chemotherapy, different types of resistances, right? Which drugs show resistances, the types of mechanism of resistance. So one of the mechanism of resistance is when the drug gets inactivated by the enzymes being produced by the microorganisms. So which of it's a common one, whether it is with sulfonamides, norfloxacin, gentamicin or tetracyclines. Okay, Surya says sulfonamides. Any other? Enzyme inactivation is a major mechanism of resistance in which of the following antibiotics? Sulfonamides, norfloxacin, gentamicin or tetracycline. Sumit says norfloxacin. Okay. Any other? Ansh says sulfonamides. All right. See, the key word here is major. Okay, so it can be seen with many, but the major. So sensitive soul says tetracycline. All right. All right. Okay. Arnav says tetracycline. All right. Okay. So the correct option here is gentamicin. Aminoglycosides का जो major mechanism of resistance is through the enzymes which are present in the membrane of these microorganisms, and they can phosphorylate, adenylate and do all sorts of these things to inactivate the drug. Right? So aminoglycosides ka major mechanism of resistance is inactivating enzymes. So remember, so gentamicin is, I just slightly changed the question, mostly it is written aminoglycoside, so I just put the name of the aminoglycoside there, right? But this has been asked quite a number of times. So aminoglycosides ka major mechanism of resistance is enzyme inactivation, to remember that, okay? So this is the answer to this one, right? So resistance be important question hai from this particular chapter. The last question of the day, and then I will tell you some important key points which you should go and revise from this particular chapter. So the last question here is, all of the following inhibit protein synthesis except. All of the following inhibit protein synthesis except. First option is tetracycline. Second option is ciprofloxacin. Third option is chloramphenicol. Fourth option is erythromycin. So all of these inhibit the protein synthesis except one. Tetracycline, ciprofloxacin, chloramphenicol, erythromycin. कौन सा option? Which of the following does not inhibit protein synthesis? I repeat the option: tetracycline, ciprofloxacin, chloramphenicol, erythromycin. Imozire says ciprofloxacin. Very good. That is indeed the correct answer. It is ciprofloxacin. It belongs to the group of drugs which is your fluoroquinolones. And can you tell me what is the mechanism of action of chloramphenicol? Shivam does inhibit protein synthesis. Yes, Surya, ciprofloxacin. So can you tell me the mechanism of action of ciprofloxacin? Why do you think it is the correct answer? Ciprofloxacin. Yes, correct. Sumit, ciprofloxacin. So what is the mechanism of action of ciprofloxacin? Erythromycin. No, erythromycin does inhibit the protein synthesis. Macrolides do that. Tetracyclines do that. Chloramphenicol do that. DNA synthesis inhibitor. Rather, they are not a synthesis inhibitor. They inhibit, we say specifically inhibit the DNA gyrase. Okay, so DNA gyrase is inhibited by ciprofloxacin, the fluoroquinolones. So that's the reason this is the odd one out of all of them. Right, so DNA gyrase inhibitors basically, to be more specific. Right, yes, exactly. So बाकी tetracyclines हो, aminoglycosides हो, chloramphenicol हो, erythromycin हो, they are all protein synthesis inhibitors. Right, so these are the few important questions which have been asked a lot of times. Right, now lastly I would tell you some take home points from this. So you can note down if you have a notebook. These are the things which you must know from this particular chapter of general principles of chemotherapy. The first is your mechanism of action. Please, mechanism of action, I mean other classification of the mechanism of action. Like which drugs are your cell wall synthesis inhibitors? Which drugs are your protein synthesis inhibitors? Which are your DNA gyrase inhibitors? Which is inhibiting the metabolic processes? So there are different classes given, and these are important because whether it's your MCQ question or whether it's your Viva Voce, they tend to ask which drugs act on what kind of, they're very important for antibiotics as such. Right, so all these cell wall synthesis inhibitor, protein synthesis ho gaye, DNA gyrase, all of them you should know that which drugs fall under. Cell wall ke under beta lactams aa gaye, vancomycin, protein synthesis ke aage tetracyclines, aminoglycosides, DNA gyrase ke fluoroquinolones hain jaise interfere with the DNA functions. Right, so all of this they will come under this mechanism. So please do the mechanism very well from this. Because the first chapter hai, your details you will do individually, but you should know classification mein which drugs which are going to fall under which mechanism of action. The second important thing to know is about what drugs follow time dependent killing, what drugs follow concentration dependent killing, what drug follow the post antibiotic effect. Okay, so please remember these. CDK, which are the drugs which follow the, I've already discussed in one of the MCQs before. So which drugs follow time dependent killing, which drugs follow concentration dependent killing, which drugs have a post antibiotic effect. So very important to know what are these effects and the examples. MCQs have been asked on different, all of them, like which drug follow this, which drug follows that. So this is very important point to know from this chapter. The third thing which I already discussed again is which are your bactericidal drugs, which are your bacteristatic drugs. I gave you a rough overview like cell wall synthesis mein jo bhi, most of the drugs are bactericidal, protein synthesis inhibitors mostly are they are static with exceptions. So go through that. Which are the bacteristatic? Make note of these drugs. Which are the bacteristatic? Which are the bactericidal? Apart from that, two more important topics here are your first is your superinfection. What is superinfection? And especially some of you who are already also appearing for university examinations where theory is also asked, not only the MCQs. So their superinfection is a short note, right? So what is superinfection? Why does it happen? Which are the common superinfections that can occur? For example, your Clostridium difficile is very important, even asked as an MCQ. So what does Clostridium difficile do? It causes a condition superinfection, or which is called as pseudomembranous enterocolitis. So drugs used for treatment of this particular condition. So superinfection is another very important short note. And among this, Clostridium difficile becomes your very important MCQ. Everything, what it causes and which is the treatment for that. Then the last one here is the types of resistances. Now, if you're appearing for university examination, then this can be a short note, so you know what are the different mechanism of resistances that can occur. But if you're only preparing for your entrance examination where only the questions are asked as an MCQ, then as I gave you one example, it is given like which of the drugs mainly show resistance or resistance is common by enzyme inactivation, whether resistance is shown by mutation in that area, or whether resistance is shown by decreasing the entry or porin channels, or whether resistance is shown by efflux mechanisms. So there are 4 or 5 types of common resistances types and the examples for that. You should know that in the resistances. So this is again very, very important. So I repeat all these 5 important actually take home points to take from this chapter on general principles of chemotherapy is your mechanism of actions that you should know. Then you should know the kinetics of these drugs. What is concentration dependent killing, time dependent killing, post antibody effect with examples. Without examples, it is incomplete. With examples. Then bacteriostatic, bactericidal, what is the difference or which are the drugs which show this effect? Superinfection and the various types of resistances with examples, right? So you should always focus on these very, very high yield topics from this topic of this chapter of general principles of chemotherapy. So I'll see you again next in the next session with another, maybe I'll take up another broader topic from chemotherapy and we'll discuss in the similar way some questions, and in the end I'll give you the important highlights or important take home points to focus on those particular chapters, right? So yes, thank you, Sumit. These are all different. Epilepsy, convulsions, seizures, they are different terminologies. You can search ki epilepsy, seizure is different, epilepsy different, convulsion is different, right? Epilepsy can have seizures, epilepsy can have convulsions, right? So this is PDF. Yeah, okay. Have you, is your name is in the list, Ahmadullah? I'll be, it's almost ready. Just the last finishing touches there. So I'll be sending you that free PDF within, I think before Wednesday, I think by Wednesday should get to you. Yeah, so there is more coming and I'll keep you posted. So all of you who haven't still joined our group, Simply Pharmacology, yeah, yes, good. So you can DM us and we'll send you the link. So stay connected with us. Anything important going on, we usually post there, and certain questions get posted over there, which is not more frequently on Insta. So do join us and keep yourself updated and posted about various things. It's a free group currently, and even the courses which we have, we keep updating you on the courses front there. PDF is not available as such here. It is only available when you join the group. There's a form that you fill and then the PDF is given. Yes, I will explain epilepsy when I take up this chapter and all, or you can definitely, I will get to know. In the meanwhile, what you can do is go to my YouTube channel. I have a, video on this epilepsy, different types of epilepsies. You can go through that, right? So when next time, because it takes a lot of time, like what is epilepsy and what is seizures, how they occur, different types. So it'll take me another session on this, right? So whenever I take an MCQs on these CNS topics, I'll definitely cover this, right? So in the meanwhile, you can definitely go and check that video of mine. Classification of drugs. See, classification of drugs is something, it's a very wide topic, right? Classification. So yes, your classification needs to be regarding which is there a special classification that you want to do? Because classification is everywhere in pharmacology. All pharma is about classification. Okay, epilepsy and convulsions. Actually, we call them as anti-epileptics. We can also call them as anti-convulsants. Yes, actually, at least for theory purpose, we considered it as the same. Because convulsions can happen in cases like tetany. It's not an epilepsy. It's a convulsion. Febrile convulsion is a convulsion, not an epilepsy. Right? The drug is ACTH. Which is also, it is not an anti-epileptic, it's an anti-convulsant. So usually whenever it is asked in the exams, it is mostly anti-epileptics which are asked to you. Okay? So there is a overlap, right? but convulsions can occur in so many other diseases or other areas also. Epilepsy, one episode of a seizure, basically we don't classify as epilepsy. Epilepsy is a syndrome. It's a huge definition what all should be there to label it as an epilepsy. But whatever drugs currently we teach the undergraduates, we call them as anti-epileptics only. Right? So yes, you can, if you know that, it is good enough. Unless you're going deep into this key, what is the reason for various drugs causing convulsions and various let's say decrease in certain electrolytes causing convulsions, that can occur. But epilepsy, to define or label somebody as an epileptic, it needs a full, a checklist. That this is there, this is there, this is there, and then you call it as label it as an epilepsy. The diagnosis, you have to go through the diagnostic features. That is epilepsy. Right? All right. Okay. Antagonist. Antagonist in itself has affinity, no intrinsic activity. That's the basic definition of an antagonist. It will block that area, not allow the agonist to get into that area. That's the only role of an antagonist. Right? That is what a competitive antagonist, what we call. It just blocks the effect of the agonist. So we say, agar hum pharmacodynamically baat kar rahe hain, we talk about intrinsic activity and its affinity. So it has affinity, but has zero intrinsic activity. Okay? All right, so meet you in the next live sessions with a new topic. Will be updated in the morning whenever we have that live session going on. So in the meanwhile, all of you who are not a part of the community, just become a part of our community. And forever, even I'm thinking how to memorize drugs forever. If there's a pill, then even let me know for that. It's all about practice, right? The more you practice, the more you learn. And there are certain tricks definitely we can always apply to memorize certain aspects of the drugs. And if you're good at it, if you keep on repeating it, practice makes a man or a woman perfect. So the more you practice, the more you will acquire it'll become very easy then for you. It's like your next, jaise aap language bolte ho, waise aap drugs ki language bolna shuru ho jaoge. But the thing is, you need to practice it. You have to put in that much of effort to get it into you. It is tough. I'm not saying it's easy, but it's not impossible. Okay? So that's the thing. All right, guys. See you next time. Have a great weekend. All the best. Take care and God bless.